I've been a radiologist for a long period of time, approaching 40 years, and I have also a ticket in nuclear medicine. So over the years, my areas of interest have varied with the, shall we say, changing trends in medical imaging, because it certainly is not what it was when I first started. All sorts of new technologies have come into the fray, and it really behoves all of us as radiologists to keep up with the changing trends. Early detection of disease is paramount in medicine. The earlier you can achieve a diagnosis, the better the chances of the patient of overcoming the particular problem. So consequently, it not only behoves the patient to recognize that there may be something wrong with them early in the piece, but also their referring doctor also should try and encourage the patient to have whatever tests may be necessary, if there are tests appropriate for the patient, and then for the patient to undergo appropriate testing. And the radiologist, of course, plays an essential part in all this, because if a condition is left unmanaged or untreated for a lengthy period of time, of course, the treatment becomes much more problematic. The first thing is, if you have any symptoms anywhere, do not ignore it. For example, if you notice blood in your urine, you've got to go and see your GP, who may refer you to a urologist, and the urologist will then determine what's the best examination to do, or he may go straight on to a cystoscopy, which is passing an internal tube into the bladder to look at the bladder. So that's one aspect of things, the serendipitous finding of an abnormality. The second thing is to do self-examination up to a certain extent. And this pertains particularly to, for example, not ignoring signs that one may notice on one's penis, because sometimes there can be lesions which are eminently treatable early in the piece, but if left untouched, become really untreatable. And also, it has been recommended to regularly examine one's testes, the same as a woman would examine her breasts on a regular basis. The third thing is also any change in any habit. For example, as men age, their prostate often enlarges. This is just part of life. There is a central portion within the prostate which enlarges with the passage of time. If, for example, the urine flow diminishes, decreases, becomes more problematic, becomes harder to pass urine, do not ignore it. Look, there are a lot of things that men can do to help themselves. And one of the things along those lines, which I would refer to in particular, is the heart. Men are notorious for ignoring their tickers. The important thing is to have regular checks of your heart, and your GP will do that. If he or she considers it appropriate, they will refer you for more sophisticated tests, which can range from an ECG to a nuclear scan of the heart, to angiography. The other thing is also that if your blood pressure is beginning to rise, that needs to be treated, because it has potential negative sequelae and needs to be taken care of.